I'm Andrew Coates, and I'm the host of the Lift Free and Diet Hard podcast. If you're listening, I hope you know the title of my podcast by now. If you're a brand new listener who's found me through my friend, Dr. Christle Guevarra, thank you for being here. It means the world. This is episode 318. So yes, I brought Dr. Christle Guevarra back. She's a whole bunch of cool stuff, including the team physician for USA Figure Skating, which is pretty badass. And she's one of my favorite people, but she's also a rising authority in the fitness industry on a lot of topics, including but far from limited to injury recovery, GLP-1 agonist medications. We're going to talk a bit about that today. And she's a cornerstone of the Renaissance periodization team. It's great to have you.
Thank you so much for having me again.
It's good to have you back. And I will see you in September at my conference, September 13th and 14th here in Edmonton. And part of having you back, the timing is because you are one of our speakers. I know you're going to do a talk. Last year, you did one on your both personal and professional experience with Ozempic, GLP-1 agonist medications, both as a physician prescribing and as a patient using. And I know you're going to go deeper, so I don't want to spoil that too much, but any teaser, I got some questions about it, but any teasers about what someone attending will get out of this? Because there weren't a lot of dry eyes in the room last year.
Yeah, funny enough, I was sort of kind of digging through, and I think with the rise of AI and with Chat GPT in particular, man, we have so much information at our fingertips. And as an older person or a more seasoned person who remembers life before the internet, it's just really incredible to see how I can kind of incorporate that and how others can sort of incorporate that. Anytime you see a sensational headline, take a pause and we will kind of work through an example together of like, this is kind of, whenever I see something sensational or something, kind of a little out of ridiculous on social media, take a pause and sit down and dig through quickly. How can I get to the bottom of this without like hitting the reshare button of like, oh my God, this is a thing. The world's coming to an end. We're going to die from these medications. Relax.
You actually went where I wanted to go here a little bit. So some of the stuff I want to do on air, obviously it won't be your exact presentation, but what are the main claims? These internet personalities, grifters, maybe well-intentioned coaches who don't fully understand, who have some sort of bias. What are the main claims against Ozempic, the biases? I've got a list of a few I'll like poke at, but I mean, what are you coming across that you're most concerned about?
Thankfully, the algorithm has been kind of working in my favor over the last year. I remember last year in particular, I saw a lot of, if you take these drugs, it's cheating and you're taking the easy way out, is the pretty much one of the top ones that I have seen, and thankfully has been out of my algorithm. I'm not quite sure if you have seen that as much lately. That's a huge one. The other one was the issue with the stomach paralysis, quote unquote. And there was a potential lawsuit case against that came up last year. There was a study that came out in JAMA with the association of the GLP-1 agonists with this potential cause of blindness. The acronym is slip in my mind. It's like non-ischemic arterial, optoneuritis, which, also has been quickly debunked on social media as well, which is great. I love the fact that there are physicians out there who are really quick with getting, the information. I know Dr. Spencer Nadolsky, who is awesome, has been really good of like trying to, fight the good fight and put out good content out there, counteracting these, sort of social media claims. But those are the kind of top three that I've been seeing, on my feed.
I've definitely seen the cheating thing. And I mean, if that's the worst thing someone can say, that's more like philosophical than it is, wow, this medication's going to cause your eyeballs to explode. So that one, I usually find it's just coaches. And there are people that I like who say this sort of thing. And it's like, I'm not all of a sudden going to be like, oh, I discard this person as a terrible person on blah, blah, blah. It's their belief system. And I think oftentimes it's content, it's talking points, it's ideological talking head bullshit when it comes to nutrition and fitness stuff, which we're surrounded by constantly. Like people are building status within their tribes and they've picked a position on something. And I mean, I think it comes from sort of an elitist place. I mean,
Yeah.
what do you think?
Oh, the 100%, especially as somebody who has struggled my entire life with the idea of hunger ever since I can remember. And I've talked about this.
Mm.
It wasn't like, there wasn't an event, there wasn't some sort of trauma. I have always just been heavier than my peers since the time I can remember, since I was about 2 years old. Like when I realized, like, oh, I'm much heavier than this person, and always had an insatiable appetite. Um, the What we do take for granted, I was just thinking about this today as a regular exerciser, we forget how much we take for granted, how easy it is for us to prepare, to plan, to prepare food, to plan and prepare, to go to the gym, to make it a priority. Those things are automatic to us, and to people who are naturally thin, who don't have to deal with these hunger signals. I just sort of eat whenever. But when you are filled with hunger, it's a driving force. It's not like, oh, I think about it. It is going to consume, that feeling is going to consume you, and it has consumed some people, particularly those of us who struggle with being obese. And it's a 24-hour, 24/7 signaling from within us. And it can affect our day-to-day activities. It can affect work, it can affect relationships, it can affect even having a nice dinner with, your significant other, because you're just so obsessed, because you're just so, this thing in the back of your mind is like, I am starving right now. I don't care about this conversation. Like, shut the fuck up. Uh, and get the food in me.
And when people talk about this like false dichotomy of like, is obesity a choice? Yes, no, false dichotomy. And then the genetic component. And then you get these people who show pictures of, oh, the 1970s are older, and there's no obese people. Like, what happened? And then they deny that there's a genetic part of it. But what you just described, this food noise, which I think is really
Yeah.
accurate, a lot of this stuff probably has at least a certain genetic component. And then you get the
Hmm.
environmental stuff like
Yeah.
modern food engineering, marketing, et cetera. That combination probably makes it seem impossible for some people. So I think that's a nice way of pushing back against the people who criticize the genetics thing. Because on the other side, I also think that the crowd that defends genetics can take it too far, because then
Yeah.
they tend to be very disempowering with their messages. And I know you don't go for that shit at all. It's like, no, 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 it's not your fault. You have no control over this. And the person sitting there going, well, shit, I'm fucked. There's nothing I can do. That doesn't help people.
Which, and I'm gonna say this now, thankfully, I work for myself. So these opinions that I'm about to express are of my own accord. It's been really a huge eye opener, being sort of stuck between, in two spaces as a physician and dealing with continuing medical education about nutrition, about training, how we're dealing with the obesity epidemic, and then being in the fitness space where there's all these other things about, practical advice. And what I find very confusing and irritating about my mandatory continuing medical education that I need to take to maintain licensure is I am getting very much lost in that disempowered um, message of, it's not your fault, it's somebody else's fault, it's the system, it's the government, it's whatever you want to call it. And the idea of like macros or calories or whatever just sort of gets kind of lost in all of that. Like, I've just did 10 hours of education, and 90%, 95% of it is, it's not your fault. We have to have mandatory contact hours, in order to bill for, the time we spent talking about obesity. There's no real practical information. Whereas with, the online fitness space, at the very least, we talk about how to approach habits. Like, what did you do today? Like, what's your day like? Talk me through, when you wake up, what do you do for breakfast? Do you, go out to eat? Do you prepare your own food? Okay, you go out to eat. What do you usually get? Like, okay, you go to a gas station. What other options do we have available? Like, that sort of kind of conversation never gets discussed in the physician space. And so it really is starting to grind my gears when, their advice, or there's actually no advice. It's, a mandatory set of contact hours, and it's not your fault. That's basically the two big things that I take home from my education on nutrition in the physician world.
it sounds like what Chris Williamson, Modern Wisdom, calls toxic compassion. And I think there's like a lot of this stuff where it's like, no, let's give people this comforting message that they have no, responsibility or
Yeah.
blame, which I get where it's coming from, but let's not disempower people and basically remove all sense of internal locus control over the outcome.
Yeah.
Now, back to the GLP-1 stuff.
Yeah.
So, yeah, I mean, I think that stuff is really valuable. I hope everybody
Yeah.
listening teases out the nuance. Some of the other things that I see people talk about are shit like Ozempic face,
Hmm.
muscle loss, which I mean that one's kind of an easy one, but I'll let you tackle it.
Hmm.
Various different people talk about side effects. You mentioned some of the lawsuit stuff, and we know that if someone's going to like be ideologically opposed to something, they're going to grab onto superficial talking points. Oh, there's these lawsuits. I mean, it's a pharmaceutical company. They're
Yeah.
literally the most like litigated against entity that's probably ever existed. And
Right.
like it's like we could go that whole big pharma bad sort of thing. It's like
Hmm.
there's a lot of really good
Hmm.
shit like insulin and other medications that have come out of there. I'm not getting into some of the other stuff that becomes
Yeah.
very socio-political. And then there's the argument that there are quote as of yet unknown long-term concerns we don't know about. So thoughts on those things?
Long term, let's work our way backwards because the long term consequences is very short answer is the first GLP-1 that was released onto market that we've been using for diabetes was back in 2005 with Byetta. I forget the generic name. So we've been using these for 19, 20 years now. We've had long-term data. So this, idea that, yes, Ozempic is one of the longer acting ones that has come about the market. But Saxenda, which was actually approved for obesity, came onto market in 2014. So we've had quite some time. Like it's just point blank. This isn't just all of a sudden. People discovered this. Yes, it has risen in popularity, one, because of the results of semaglutide, and tirzepatide, also with social media. Back in 2005, we had what, MySpace and Friendster? Like Facebook was barely a thing. And the weight loss effects were not as drastic. So that, we were mostly using it to treat diabetes, but we have exposed many people to these GLP-1 agonists for so long that, you know, if, all of a sudden it's not like, oh my God, we see, we haven't done our due diligence. We haven't gotten years of data. These things also, these people have forgotten how long it takes for a drug to come into discovery, to go through a phase 1 trial, a phase 2 trial, a phase 3 trial, phase 4 trial after it comes to market. That's a decades long process. I remember being a lab assistant back in the early 2000s, and we were doing diabetes research. It was a very tedious process. So it's not like we just like to yesterday decided that like, oh, here's this drug, here you go, have a nice day.
And I mean, there's a bit of a false dichotomy, but we definitely know the long-term data consequences of
Of
obesity, diabetes, the things that ultimately Ozempic is helping, deal with.
Yes. Oh yeah, not even, yes, exactly. And those are, it's a slow, painful process. So there's your first one.
Hey, there's
Um
blindness. Like literally blind, you're worried about
yes.
blindness? That is
Yes.
a downstream thing of uncontrolled diabetes.
Right. So yeah, as far as chronic elevated blood glucose, so blindness, because what happens is that affects the nervous system. That literally damages all the nerves. It damages all the arteries. So, for people with type 2 diabetes, you have to get more involved regular eye exams. Every time I see a diabetes patient with diabetes, I have to check their feet for their sensation, because wounds, you don't realize that you're going to step on something. And yeah, it's a not a fun road of infection. Um, and oftentimes the other part, so infection, a lot of other parts, erectile dysfunction too. That's also, an unfortunate consequence. And I say that because a lot of people, those are things that people care about, right? Like, a toe here, a toe there. Sometimes some people do care about it, but making sure that your parts work, people give a real crap about that. So
Hear that, guys? Go get your Ozempic, okay? If you want to be able to see it, you haven't seen it in a few years, and then to be able to use it, Go get your Ozempic. I, I
So
I don't
yeah,
want to turn this into a Ozempic commercial either, but like,
yeah.
the reason why I ask all this stuff is because the
Hmm.
coaches listening, they are going to be dealing with clients coming
Yeah.
in who are going to have questions. They're going to be using it. I have multiple clients
Hmm.
now who have gone to use it, and from what I've seen so far,
Yeah.
great success with
Awesome.
fat loss, with their
Yes.
energy, how they're feeling in life. And
Yeah.
they've described something similar that you have is like the food noise is gone,
Hmm.
right? And they've really struggled. And we're talking about, I can think of one of my clients very frustrated, just really not feeling like any control over the situation. And we're starting to see a shift the other way. Now, oh, you first.
Oh no, I was gonna say that's so awesome. That's so awesome to hear. Like I love the fact that you have, interacted, you have clients who are on these drugs and you are playing an incredibly important role in all of that, right? Like coaches, just because these drugs are here does not mean you're going to be out of a job. If anything, you are more in demand, more so now than ever. Please, love.
Well, this comes to the next one
Yeah.
is the muscle loss. So this is where coaches matter. So tackle that one.
Oh boy. So the last I checked, a lot of the studies that talked about the weight loss, and I get it, if you're dealing with thousands of subjects, it's really hard to standardize everything. The resistance training. You just have to lift weights in any type of weight is fine by me, whatever gets you in the gym, but working with a coach, working with a personal trainer, working with an online trainer will also be great in helping you navigate what does that actually look like? What is my when I get to the gym, like what am I going to do? Am I going to just lift, 2.5 pound dumbbells? No. We're going to, challenge. It's going to be challenging, but not too challenging that you injure yourself. And I think finding that, fine line is, where coaches and personal trainers can really shine because a lot of people are so lost with how to do stuff. But as long as you provide resistance training, you are going to preserve that muscle. I promise you. I have done many a diet in the past with just cardio, and have always been very disappointed in the 90s. And so I'm very happy that, a decade afterwards, I discovered lifting weights, and it has just been nothing but a net positive in every aspect of my life.
How comparable, because this is my understanding, how
Mhm.
comparable is the muscle loss between someone who is like traditionally doing a diet without
Mhm.
resistance training versus losing the weight via Ozempic?
So so that's going to be tough because the other parts to that I think the other nuance part to that is also the rate of loss. And that's also another problem that you do now that I do recall. So if you aren't really monitoring, if if you're not monitoring stuff and the client or the patient really isn't saying anything, what potentially can happen, and I've seen this happen, is you have a patient who is so excited for that food noise to go away, and their dose is so high, they're barely eating anything. Like a handful of blueberries, like, a couple nuts, and like call it a day. But they're so happy and excited that for once in their life, and it really just like I feel for these people because I know this feeling, how it goes, but that they're so excited to just not have that food noise anymore, that they are like the idea of trying to decrease the dose, increase their food intake is like you bring that up and their like head explodes. They're like, no way. Like, I don't want to ever go back to, where I was before. And so that becomes a really tough conversation to have. Um,
How challenging is it? I mean, from your own personal experience
mhm.
or any anecdotal stuff you've seen or any data that's out there? Because if appetite's suppressed, we know that protein, generally speaking, is the most satiating thing.
Right.
Then do people tend to, when they're on Ozempic, almost go for the higher calorie stuff anyway, or are they less inclined to actually eat protein because protein is so darn filling anyway? They just don't have the appetite to consume it.
That's a really good question. The stories that I have seen, I haven't really seen too many, I haven't really worked with too many people where it's, they're on Ozempic and they're just like, I'm just going to eat less pizza, or I'm just going to eat less, of everything else but protein. I think for those people, sometimes it could be that, um, yeah, I haven't encountered it.
Mm.
I wouldn't be surprised if I've seen that. That was just one case, and I wasn't working with them directly. I feel like people are starting to really now like, oh, Ozempic protein, like it's important, and I've seen that consistently in both spaces. Whether or not that's actually true, because I think people also struggle with the idea of tracking, measuring and tracking, or even just loosely tracking, because there's a lot of people who are still very confused about portion sizes and I'm not losing weight, or I'm not gaining weight, or I'm not maintaining my weight. But I don't really want to track because I still see that quite often. And it's like, well, there's, in order to get to the bottom of this, we probably need to start tracking just a little bit to kind of see what the issue is.
My assumption, and I
Hmm.
don't know how back this is a data, but I think it makes
Hmm.
most sense, is if you combine or have some aspect of people eating less protein
Hmm.
and no exercise, that
Yeah.
would probably explain a lot of the muscle loss. I mean, even, and correct me if I'm wrong,
Yeah.
my understanding is if you get someone who loses weight, and let's say they lose a substantial amount of weight over a long period or whatever period of
Yeah.
time, they're going to lose some muscle, even with
Oh,
resistance training and with good protein intake anyway. And that's not even necessarily a bad thing.
yeah. Oh, yeah. Um, yeah, it's I haven't so it will, but also the other thing too is like we're not exactly, I haven't seen too many studies where they're actually getting DEXA on, super large people. And kind of tracking that. So, and with, it is a little bit difficult to assess body fat percentage
Mm,
visually
mm.
in those cases. So in those instances for that part of the general population, man, yeah, it's going to suck that they're going to lose some a bit of muscle, but what's the alternative, right? Like what's the alternative? We have excess adiposity, absolutely no motivation to do anything. So lesser of the two evils. If we get rid of the excess adiposity, maybe, I think that overall it's still a net benefit compared to worrying about this, oh my God, Ozempic face, or oh my God, I'm going to lose muscle. You know,
And is there any, so that was the other one, is the Ozempic phase. Is there
hmm
any indication that Ozempic, over and above the effects of losing like fat from your face, is somehow causing this thing? Or is it probably just due to the high profile examples of celebrities and the rate of weight loss and and the degree of overall change?
So that Ozempic face is just going to come from the weight loss. No matter, there's nothing special about Ozempic that's like, oh, I'm just going to get this, sunken in face. I mean, bodybuilders get,
Mike,
awkwardly
when Mike
sunken
gets
in
lean,
faces all the time. Yeah.
right? When Mike gets lean. We're talking about Dr.
Right.
Gazatel, by the way. So
So, on top of that, for, the skin, and also depending on age, too, like, the collagen fibers. So you shrink that face and if you've been overweight and obese your entire life with, a little bit of a more full face with that decreased collagen production, a little bit skin, isn't as tight. So yeah, you're going to have some notable changes, especially if you lose weight in your older, years compared to somebody who has lost weight, at the age of like 19 or 20. But also depends on how much that skin has stretched out.
mm.
Because I've seen, I think, what is it? The like 1,000 Pound Sisters reality show at some point. Yeah, and one of them has gone through bariatric surgery, has lost a lot of weight, but being a little bit older and then starting with a really large face, it's going to look different, and that's okay.
I mean, I guess like a
Yeah,
minor example of kind of what you deal with like loose skin after
yeah,
really, really significant weight loss, right?
yeah.
But ultimately, none of these things sound like they're major things that are specifically driven by Ozempic as a medication,
Hmm.
as opposed to just consequences of losing the overall body fat. And you clearly implied that, and I agree, that the net benefit is to get rid of the excess adiposity for the long term.
Correct, correct. And also with these individuals, depending on how large your starting point is, that weight loss, may turn into I see that it does give a lot of people a lot more motivation to continue to get moving, or even start moving. So if it requires that, you're on Ozempic, if you are very large to start with, you have a lot of weight to lose, and you start on Ozempic, and yeah, if your mobility is not great, even just walking is still better than nothing, because at some point the weight is going to come off. And what happens is people start to, expand their, what they consider to be daily exercise. So instead of walking a block, you're going to, maybe go to the gym, maybe get on the elliptical. Maybe I'm going to start, venturing into the weight room. So all of these are on a spectrum. Yes, there's always going to be pros and cons to, oh, I'm going to lose muscle if I just don't do this perfectly. But man, the analysis by paralysis, like, just get it started. Like, let's just get the party started. Let's work together. And, nothing happens in, like, it doesn't have to be like this set perfect order of like, oh, I got to do this and then I got to do that. You can do many things, all at once.
What about, this is another one that I keep seeing too,
Yeah.
is the criticism concern over being on Ozempic long term or needing it.
The hunger signals will continue to be there. I think that is more of an ideological kind of mindset. If those are also the same, usually the same people are like, oh, it's cheating,
Yeah.
right? It's the data suggests that once people do go off of the medication, not everybody gains all of the weight back, but a majority of the people gain a lot of the weight back, is what I've seen so far in the literature. I think it's a case by case basis. There are some people who may do very well once they get their kind of nutritional habits in order, once daily, consistent exercise is a priority. There are some people who do wean off of the medication and seem to do quite well. I like to, as a physician, I always like to, and as a project manager, I always like to underpromise and overdeliver. So I never want to be like, oh yeah, it's going to be great. You can totally do this. We're going to be wonderful. I always like to preface it with the worst case scenario, and then with the caveat that we can always go back on the medication if you wish. Like, if you start gaining weight or you start having the increased food noise, no big deal. Because again, it's really that signaling mechanism that's going on. There's nothing, moral about it. It just happens. It's just your body. It's just your body's chemistry. Like, and we have a solution for it.
It's probably the statistics are probably similar for people who lose the weight via traditional dieting, whether like done well, planned, or this, the unsustainable fad yo-yo dieting structure. And then the people who make the substantial lifestyle changes along with it, they probably have greater rates of success. I would assume so. And then the people who use it, because I think Ozempic, I want to be careful how I say this, but I think it can be used like a fad diet. And if you use it
Hmm.
exactly like a fad diet, it will function that way.
Hmm.
And then when
Hmm.
you come off of it and you think, oh, I'm just going to go back to living and eating the way I did before, I've already lost the weight, I should be good. No, no.
No.
That's what gets people in trouble with fad
Yeah.
diets. And that's why they
Yeah.
over cycles this stuff, actually lose muscle mass and gain more
Hmm.
body fat long term. So I can see Ozempic like with the wrong approach. So I personally, I think, okay, it has to be a piece of a puzzle to facilitate
Hmm.
major lifestyle change.
Oh, 100%. And that's the other bit to it that I think, as a physician, really doing a great, we need to do a better job of not just, hey, like, you need to just read this one book. You just need to, carbs are the devil, which I literally had to, I found myself arguing on the internet last night with a physician. My retort was, carbs are literally not the devil. please. Um, uh, and just let people know, like, what are you willing to do for the rest of your life? Like, what is your ideal life look like? What, because clearly whatever you're doing right now is not working. So you need to find a way to reconstruct your life piece by piece and find something that is sustainable for you. And it's, there's no one set path of like, if you just do this, you're going to be fine. No, there's always going to be trade-offs to stuff. So, obviously, like, we don't have the same 24 hours in a day. So you have to work within what, your parameters of what you've got going on, your relationships, work requirements, family requirements, job requirements, all of that needing to take into consideration before you can, figure out, like, what is my life now going to look like moving forward in order to, get the physique I desire, having the health outcomes I desire, or whatever it is that, your goal is.
Any other tactical stuff for the coach listening who's going to be encountering more people using Ozempic, wanting to go on? Anything that's going to help them with the conversations about it?
I think asking them about so one of the major side effects, biggest side effects, particularly with semaglutide, is the nausea, just the nausea, um, and making sure that they're staying well hydrated, because that's also another thing. So once you lose the appetite, I don't really feel like I need to drink at times. So just making sure that there's a plan in place to make sure they get their water in. So because I've seen that happen a lot before. And if not, if their side effects are a little bit too much, really encouraging them to go back to their physician and talk to them about it. Maybe we need to adjust the dose, or I'm really, struggling. I'm really hungry, still really hungry all the time. That's a conversation to have with the doctor. And I think what's really also great about the fitness space is I've seen a lot more courses, certification courses that, really alert the personal trainer, coach about what things are, like, what medical conditions that are out there that you need to be mindful for, but not necessarily just for your own edification. So you can advise your clients appropriately, and like, hey, this sounds like, you need to talk to your doctor about this, or this really sounds like, this is going on. Have you discussed this with your doctor? And really encouraging that conversation, because I also think, coaches are spend more time with these clients than a physician, really, most physicians ever do. Let's be real, the system has set them up to fail
Mm.
for, 15-minute appointments, trying to, like, it's a factory. So I get it. But being able to listen to the client and kind of help them navigate through whatever it is that they're experiencing or feeling, um, is and encouraging them to go to their doctor with that kind of feedback is really important.
What you just described, I mean, I don't know if you were listening to Modern Wisdom, but I know that Chris just had a guest on who's a physician. I wanted to see this. Dr. Mike, not your Dr. Mike, but
Oh, the other Dr. Mike.
the other Dr. Mike, reacting to the rise of anxiety, microplastics, and antidepressants. And I know it's a big episode of like a whole
Mhm.
bunch of stuff, but I know he talked about the problems of the modern healthcare system. So either way, like I like Chris Williamson's Modern Wisdom podcast. I'm really happy. I know Dr. Mike Israetel has appeared on it numerous times now, and he's always really funny. So I mean, anything to support RP as a whole. Now, speaking of that, for
Yeah.
you, since the last time we talked, you've had more time with a firm foothold in the fitness industry. What's that experience been like? What are you looking at for your own personal growth? Because obviously RP as a brand has
Yeah.
continued to explode. It feels like you guys have always been a really big juggernaut, but like the success of the YouTube channel is unprecedented. It's nuts. And so, but for you personally,
Oh,
what are you focused on? What are you excited about?
oh, man. So difficult question to answer, because I do wear so many different hats. As far as my own personal, brand, I think right now it's a little bit on pause, just because there are so many things on the back end, with the YouTube channel. that I've been able to just, as a physician, as a primary care physician, transitioning into project management was sort of a natural and easy transition. And so, I have to talk to people, I have to communicate with people, I have to stay organized, I have to anticipate, potential issues. If an issue comes up, like what are these causes? It's all very similar to my job as a primary care physician. So, that the YouTube channel in and of itself has been a really awesome team to be a part of, and to, play, such an important role has been very fulfilling to me. Especially, since the COVID pandemic has kind of left a little bit of a sour taste in my mouth as far as the medical system goes. So I just kind of felt really lost afterwards, in terms of like career fulfillment, like what am I doing here, et cetera. The other thing too is kind of finishing up the Bodybuilding Anatomy third edition book coming out with Human Kinetics, reviewing artwork right now. And so that is set to be released ooh, in a couple months, I believe. So the manuscript's done, it's written. So we are good to go with that. So I'm co-authoring that with Mike as well as Jared Feather, IFBB Pro, also RP coach. Um, and yeah, I think that's about it. Whether or not I decide to go and really start ranting on, starting to provide information on, as far as nutrition goes, training goes, there are definitely times where I feel like, oh man, everybody says it so well. Everybody does such a great job with this reel or this one saying. I'll just reshare and call it a day because they're all really good. And you so eloquently just like put in those, like, that sentence with the nuance and the post. And I'm like, yeah, I'm just going to reshare it because I enjoy it. So, right now my plate's pretty full, long and short of it. I think in another 6 months, I will start to kind of loop back and see how I can be helpful. Right now, I'm still just sort of monitoring the medical space and the fitness space and kind of seeing where I fit in with all of that, if that makes sense.
Totally does. And no pressure on anything. And just curious because I know there's a lot of good there to unleash a little bit more. But I mean, Renaissance, I know you're important part of Renaissance periodization as a bigger entity and a brand. And I know that
Hmm.
Dr. Mike is sort of like the face of it in a very big
Hmm.
way. But
Hmm.
it's a big team. And shout out to people like Elizabeth and
Hmm.
Carolyn, my good friend,
Yes.
and Arthur, and like I know there's like just a whole I'll miss everybody, so forgive me for not saying, but if you guys are listening, you guys have been always great to me, so I appreciate RP, and I will definitely be grabbing a copy of that book. So guys, keep that on your radar. I can't wait for that.
Yay.
And for anybody listening, I love episodes like this because there's something very specific and tactical about it. So there are probably trainers that you're friends with who are going to be like, okay, cool. I need to share this with you. That is how you help me. And that's how you let more people find out about Christle. So where can they find you on Instagram?
Dr. Dr. period Christle, Christle, on Instagram.
Awesome. And yeah, share this episode, please, with your friends. And anybody who's thinking about attending my conference, please send me a message. I would love to have you there. I think we look great for this year. I'm also excited. I'll be speaking at the Vigor Ground Fitness and Business Summit. That's what Luca's event. Luca will be at mine.
Mm.
I will be at his. And that is in Seattle, October 10th through 12th. And I think, yes, I'll release this and I will be flying to visit my family in Newfoundland for a week, and then I'll be flying back through Toronto. And me and Nick Shaw, amongst others, will be speaking at CanFit Pros Global Conference. So if you're in the Toronto area or want to come in, that is, I mean, I'll be there on the 9th and the 10th. I know it's like kind of
Mhm.
a big trade show conference thing. But anyway, so me and Nick Shaw will be there. So come hang out with us there, but come to my conference. All right, I've sold it enough. I'll probably have a few more of my speakers on as guests in the coming weeks. Thanks for tuning in, everybody. Christle, you're amazing as always. Thank you.
Oh, thanks again.